So what I'm showing you right now is a diagram of the normal anatomy of the anal canal and also the anatomy of an abnormal anal canal where hemorrhoids formed. So normally we have veins on the outside and the inside that are typically very flat and not engorged or swollen. There is a line here where you can see the dentate line. Everything down here, this cream color, is below the dentate line, and that's the nerve line. So there's lots of nerve endings here on the outside. There's not that many pain nerve endings here on the inside. And so external hemorrhoids occur on the outside. External hemorrhoids are veins that get enlarged below this nerve line. And so external hemorrhoids tend to hurt. They present as a blood clot within this vein on the outside, and they cause stretching of the skin. And that skin has a lot of nerve fibers, pain fibers. And that's why external hemorrhoids hurt. Internal hemorrhoids are located on the inside. They're located typically in three locations: the right anterior, right posterior, and left lateral locations. So when we talk about internal hemorrhoids, there's three columns where they're located. Internal hemorrhoids can be small and on the inside, which we call grade 1 or 2. And when they are prolapsing out, like this one here, we call them grade 3 if we're able to push them back in. And we call them grade 4 if they come out and we're not able to push them back in or reduce them. So the technique that we use to treat internal hemorrhoids that I specialize in is a technique called hemorrhoid band ligation. It's a procedure with a disposable device. It's a one-time use device that goes above this nerve line, and the device is about the size of my pen. It goes in about this far, about an inch and a half on the inside. We're able to suction in the hemorrhoid above the nerve line where there's no nerve sensors, and we are able to fire off or place a tiny little rubber band at the end of this hemorrhoid. It cuts off the blood supply to that hemorrhoid, and it painlessly falls off within the next couple days. And so what we do, if you recall, I mentioned there's 3 areas of hemorrhoids. We place one band every 2 weeks until the hemorrhoids are gone. And on average, patients need about 3 band ligations before their symptoms get better. The other common condition that occurs is what this is showing you here. This is an anal fissure or a crack in the skin. Anal fissures are painful. They are below the nerve line. They can hurt, they can itch, they can bleed, and it's very common that I hear patients describe the feeling of razor blades passing when they're having a bowel movement. Fissures can be treated with creams such as nitroglycerin or diltiazem cream, and sometimes these fissures need to be dealt with surgically, which is something that colorectal surgeons can offer to a patient.